video, I will be discussing cultural differences in treatment of schizophrenia in the United States, treating patients with the biomedical model, and in Tanzania, using family and community support according to the research of Julie McGruder, as discussed in Crazy Like Us, written by Ethan Waters. Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. When schizophrenia is active, symptoms can include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. In Western communities, hallucinations are viewed negatively and must be rectified immediately with medical treatment. In contrast, in Middle Eastern and African communities, this symptom is viewed as a gift, like speaking with God. The treatment of schizophrenia differs between Western and African cultures. Western culture relies on the biomedical treatment such as medication and psychotherapy, causing the patient to be isolated and viewed negatively. In contrast, Zanzibar culture promotes the treatment of family support, which encourages the patient to experience their symptoms without fear of judgment. This can be further explained by Julie McGruder.
So brain disease models that say you're flawed and it's genetic and it's neurological and you're going to have this for life are not pushed. When patients default on medications, the attitude of practitioners prescribing that medication is not punitive. There are lots of alternative spiritual explanations, and they're not ridiculed. They're generally accepted, even by mental health practitioners.
I am Mexican American, and in this community, views and treatment of schizophrenia differ for Western culture. In a recent study, Hernandez and colleagues suggest that Mexican Americans don't view schizophrenia as detrimental, similar to the people in Tanzania. Mexicans also promote their support of family, describing mental illness using words such as nervous or tired. This study also found that compared to European Americans, Latino families relied on the idea of hope for their loved one to be cured rather than medical treatment. In conclusion, it is unethical to assume that the biomedical model will work for all individuals. Psychology has enforced the ideas of Western culture, however, this is not always the answer. We must become culturally competent for us to grow and to learn.